Okay,
Uh,
good evening, everybody. Good night to our viewers and listeners. We welcome you to our weekly program, Healthy Me, Wealthy Me with Dr. Lincoln Carty. And tonight we invite you to view with us. And we thank you in advance for your patience. And Dr. Carty will be having an exciting program as usual. And we all know that if we are healthy, we are wealthy. So we have Dr. Carty with us, and we thank you for allowing us on your tablets, on your phone, on your computers. We thank you for your continuous support. Please do not forget to leave your comments below the broadcast on Facebook, and we thank you also our YouTube viewers, our YouTube followers, and whoever pops up on this video. Don't forget that you should subscribe to this page for more videos like this, more programs. And we say thank you one more time, and we will not delay, but allow Dr. Carty to start up with the program. He has an interesting topic for us tonight. And we thank you, Dr. Carty. You are welcome.
Thank you very much. Good night, everybody. So good to be here again. And I just want to remind you before I begin that the information we are providing in this presentation tonight is provided for educational and informational purposes only, and it is not intended as medical advice. Please do to diagnose or treat any illness, metabolic disorder, disease, or health condition. You are reminded that before starting any nutritional exercise program, you need to check with your physician or healthcare provider. Thank you very much. So I am here from Lumari Natural Health Consulting, where we encourage individuals to empower your mind, to enhance your body, and then to embrace your whole life. Tonight, we want to share with you on the topic, detoxification, natural cleansing for the mind and body. Natural cleansing for the mind and body. Because remember, you can't just clean the body alone. The mind also has to be cleansed. That is very important, especially from the point of view of detoxing, um, cleansing your body and giving you that spiritual high. That is so important. So what are we going to be talking about tonight? The first thing we will do is we will define detoxification. So we'll answer the question, what is detoxification? And then we are going to look at some general detoxification systems. We are going to discuss a little bit on the benefits of we cannot leave out those nutrients that support detoxification. So we are going to be looking at some of those nutrients supporting detoxification, and then we will end by giving you some general guidelines for detoxification. Remember, these are just general guidelines, and you can do your own research and choose whatever interventions you would want for your own detoxification program. And so even before we define detoxification, I want to just take a few minutes to lay out the case for detoxification. Why is it necessary? Why is it important? Some people may be asking those questions. And one of the main reasons is because of the high level we are living with today. You see, toxicity has become a great concern in our modern world. In fact, threatening our health are powerful chemicals, air and water pollution, radiation, and the nuclear waste. You might say, well, maybe not for us here in the Caribbean, but yes, there are individuals who live in areas of the world very close to nuclear plants, and every so often there are leaks. So nuclear waste is also an area of concern. And by the way, even in the foods we eat, we ingest new chemicals, we use more drugs. When I say we, I mean those people who use drugs, because I personally, do not go for pharmaceutical drugs. But individuals also eat more sugary and refined foods, and as a result, there is abuse to our bodies on a daily basis. And that information actually came from one of my nutrition professors, Dr. Elson Haas. He, along with a lady, Daniela Chase, they wrote a book way back in 2004 entitled The New Detox Diet, the complete guide for lifelong vitality. And this is some of the information they would have shared in that book. And so when we think of toxicity, we think of it in terms of different levels. In fact, there are two main toxicity levels. There is what we refer to as the external level and then the internal level. And externally, we think in terms of the air, what we breathe in. So whatever we are breathing brings with it toxins. Then we think in terms of ingestion. The foods we bring into our bodies, they come from the outside. So they are external factors. And then we think in terms of physical contact, things which you touch or things which come upon your body, maybe through your clothing, as the case might be. So these are external levels of toxins. And then internally, what goes on inside of the cells and tissues of the body. So there is what we refer to as biochemical activity which takes place in our bodies, release toxins, and then there is also what we call cellular activity. So those and we are going to but in a more general, we take a look at toxicity levels, and one of the things we would note is that most drugs, food additives, and allergens create toxic elements inside of the body. Drugs, food additives, and allergens, they create toxic elements inside of the body. In fact, any substance can become toxic if you use it in excess. Believe it or not, water can become toxic. Because if you consume too much water, then it negatively impacts your body. The toxicity level would rise. I mentioned biochemical and cellular activities. These take place inside of the cells and tissues of the body, and they generate molecules which are called free radicals. And these free radicals are toxic in nature. In fact, they are actually biochemical toxins, and they are considered to be a common factor in chronic disease. So that if you are producing these biochemical toxins called free radicals, and you're not getting rid of them out of the system, out of your body, then you will end up with what we call chronic diseases, such as diabetes, arthritis, various cancers, hypertension, you name it. These are the result of free radicals or toxins in the system. So what are toxins? And a picture says 1,000 words. So that picture tells you that toxins are poisons. Toxins are substances that create irritating or harmful effects in the body. They undermine our health and they stress our biochemical or organ functions. That's what toxins do. In fact, some of them, such as pesticides or some drugs, may produce what we call immediate or rapid onset of symptoms, while others may have what we call long-term effects, such as what happened with asbestos leading to lung cancer. That takes a long time, but eventually it will happen. Once you have been exposed to asbestos over a period of time, it will eventually lead to lung cancer. Okay, remember we mentioned a little while ago external and internal toxicity levels. So let's examine external exposure. Toxins are all around us. We cannot escape them, but at least we can do something about them entering the body, or once they get in, we can do something about them in order to get them out. So we are exposed to thousands of toxins and chemicals on a daily basis. We're at work, in our homes, through the air we breathe, our food, our water supply, and also through the use of pharmaceutical drugs. So all of those things create toxins in the body. In fact, many of the toxins that are abundant today did not exist 30 years ago. And that's because of the rapid industrialization that is taking place. So let's look at some of these external toxins. What are they? Here are some examples. Heavy metals, such as mercury and nickel, cadmium, lead, you name it. Those heavy metals are toxic in nature. In fact, the mercury is used in amalgams which are used for filling teeth. That is so dangerous. And there are many persons who would have fillings in their teeth. It is good that the research is now showing that there are other composites that cavities, but yet there are still lots of individuals walking around with mercury amalgams. And you know, if you have that problem, then you would need to visit your dentist and have them get rid of those mercury amalgams and replace them with the more safe composites. Then there is alcohol, hydrogenated and trans fats, which we get in some of the foods that we use. I mentioned pharmaceutical drugs. The very smoke that you inhale on a day-to-day basis. I mean, I try very hard to stay away from areas where they are barbecuing chicken, especially on weekends. There seem to be a barbecue craze now, and almost everywhere you turn in the evenings, you have these barbecue grills going and just smoke all around the place. And then there are agricultural treatments such as herbicides and pesticides. All of these are packed with toxins. There are petrochemicals, solvents and industrial chemicals, you name it, food additives of all types. All of these are external toxins which come into our bodies in various ways. Let's just zero in on some of them, and we'll just mention a few things we can do about those. Take water, for example. Many toxins get into our water through pesticides, herbicides, industrial pollution, pollutants, aluminum, lead, which I mentioned a while ago. They're now moving away from using lead pipes, using PVC pipes, but even PVC pipes have their own set of problems. So what do? You want to use reverse osmosis or distilled water where possible. You see, reverse osmosis helps to get rid of many of those toxins from your water supply. And then the air around us is also filled with toxins. For example, there is dust, there is smog. There are some places in the world you go, you could hardly see the sky for the smog that is in the atmosphere. The ozone is packed with toxins and various particulates. You inhale the clothing, the upholstery that you use to make your furniture, even the very buildings, some cleaning materials come with all kinds of toxins. And so what you want to do is to use what we call non-ionizing air filters to filter those toxins out of the air, especially, you know, in your homes. They use air conditioning units in offices, but even those have their own set of problems because of, you know, electromagnetic radiation and so forth. And then there are synthetic use. We have toxic dyes which people use. Folks, look at my silver here. I look like a silver fox, right? Yes, and I love it. It started in my 20s. And believe it or not, I started dyeing my hair in my 20s. Until even before I turned 30, I learned about the chemicals that are found in the dyes, especially lead. Yes, lead was found in the dyes in those years back. And I decided that my brain, my mental faculty was more I stopped my wife from dyeing my hair, and I have been gray from since then until now. And I appreciate that. You don't want to use those dyes because of the and then there's formaldehyde. Same formaldehyde that is used for preserving specimen. The same formaldehyde that is used as one of the components of embalming. Yes, that formaldehyde stays in the chipboard for up to 15 years. And a lot of furniture which people use in their homes, in their offices, are made from chipboard. And then there is arsenic. Arsenic is a deadly poison, and believe it or not, arsenic is found in the feed of chickens in some places in the world. Okay, they put it in the feed of chickens. And then there are parabens, a group of toxic chemicals. Some of them could even show up in plastics. So what we want to do is instead of using, you want to use natural products as possible, natural materials, natural woods to make your furniture. Things we can do to ward off toxins. And then we think about our food. The food could be contaminated by pesticides, by preservatives, and also by heavy metals. We would have mentioned those before. So what can you do? You can eat less processed foods. Remember, we spoke about nutrition sometime before. So you can eat less processed foods. You want to go organic. You want to go vegan. You want to use, if you're using meat kind, it's best to use fish. And some of the fish that I deem to be okay are fish like salmon, trout, haddock, flounder, herring, sardine, or mackerel. And when I speak about sardine or mackerel, I'm referring to fresh sardine or mackerel, not mackerel that is found in the tin, because the canned stuff contain contaminants, especially organotin that comes from the can itself. And then we mentioned the dental materials a while ago, the mercury that is found in amalgams, and then there is nickel that is found in some stainless steel products. There are also plastics that are found in some sealers. And so um, you want to try and get those out of your system. In fact, we are told that the life of a filling is about 22 years. So imagine having that mercury in your teeth, in your cavities for 22 years. What do you think is happening to that mercury during those 22 years? It is actually seeping out of the amalgam and getting into your body and causing problems. Okay? Remember, we said some time ago that mercury actually impacts on your nervous system. So that was external exposure. Now let's look at internal exposure. What happens by the time toxic foods and drinks and additives get into our bodies? You see, these toxic waste products are created every day in the body from the metabolism of our foods, the metabolism and production of hormones, and energy from reaction of microbes such as bacteria, viruses, and parasites. So all of these chemical reactions, the biochemical reactions, the metabolic reactions which take place in our bodies actually release toxins. And just a quick look at this picture I have on the screen here. It mentions things like MSG, aspartame, high fructose corn syrup, and you see a whole list of foods there which actually are laden with toxins. These are what we call fast foods or junk foods. They're all laden with toxins. You want to get rid of those from your diets. And so one of the things we learn is that internal toxins, they could also be produced by chemical reactions in the body due to unhealthy emotional behaviors such as anger, resentment, chronic worry, fear, and sadness. Now, do you see why we said it is important not only to detoxify the body, but also to detoxify the mind? Because all of these behaviors start where? Not in the gut, but in the mind. Okay? And so the body craves homeostasis, meaning balance. The body wants to balance itself. And so the ability for the body to maintain a balanced or constant internal environment in response to changes, whether internal or external, that is what homeostasis is. So the body wants to create a certain degree of balance. And the difficulty or the ease with which the body is able to balance itself is dependent on the level of toxicity in the body. So the more toxins, the more difficult the more difficulty the body has balancing itself. The less toxins, then the more ease with which the body can balance itself. Where are toxins stored in the body? Various organ systems in the body actually store toxins. One of them is the brain. So the brain actually stores some toxins. The liver stores toxins. In fact, the liver is the main detoxification organ in the body, and we are going to zero in on the liver in just a little bit. But fat tissue also stores toxin. In fact, for those individuals who may be obese, I would want to warn you that much of the toxins is actually stored in the fat. So that because fat has a very high affinity to toxins. And so you want to get rid of as much fat as possible from your system. So slim and thin is in as far as keeping a healthy body is concerned. The spleen also stores some toxins, and then the lymphatic system, and you notice the lymphatic system covers just about everywhere in the body. And every so often, you find lymph nodes, whether in the area of the throat or the thoracic duct, the thymus gland, in the groins, under the armpits, you find those lymph nodes. We refer to them as little children as kernels, so that if there is inflammation anywhere in the body, those lymph nodes become swollen and they actually hold on to the toxins in those areas. So you have your tonsils. Those are lymph nodes as well, and they can become inflamed very easily. So you have to be so careful to get rid of toxins from the entire body. Now I put this picture here to just have you take a quick look at the dangers of toxic deposits in the body. So that when toxins are allowed to build up in the body, a number of things could happen, starting from head, come down. So there is memory loss, and memory loss leading to dementia, Alzheimer's, and various other cognitive problems as a result of toxicity in the body. Blurred vision, not being able to see properly. Then there is acid reflux or GERD, dyspepsia or acid indigestion, which you learned about not too long ago. Then there are central nervous system disorders, increased risk of breast cancer in the females, unexplained weight gain. And one of the reasons for the buildup of weight is so that there could be more adipose fat or fat tissue for the toxins to find a home. And then there is increased back pain as a result of toxicity. So some people might have back pain and you're not quite certain why. It may be because the toxic levels are too high. Then we have what is called IBS or irritable bowel syndrome, low testosterone in men. So men, if you continue eating junk food, you'll suffer from low testosterone levels. You will be losing your manhood a little bit too early. So you want to get rid of those toxins to stay masculine for a longer period of time. Then there's increased risk of colon cancer when there are toxins in the system, and joint inflammation, stiffness of the joint. So all of those are examples of the impacts of toxins on the body. Now let us look at the effects of toxic overload. You see, toxic overload could create dysfunction in various parts of the body, and that dysfunction manifests itself in the form of various symptoms. What are symptoms? They represent the body's attempt to auto-regulate or to self-heal. Remember I said earlier, the body tends to go into that state of homeostasis. It wants to balance itself. Symptoms, these are like warning lights on the dashboard of your car. The problem with some of the approaches of allopathic medicine, however, is that the focus is on the symptoms rather than on the causes of the symptoms. So we have to be so careful that we don't just try to mask the symptoms, but we go after the causes of those symptoms. So what are some of the symptoms of toxic overload? An exhaustive list, but just to show you, headaches, joint pains, coughing, sore throat, tight or stiff neck, high blood fat levels, backaches, frequent colds, irritated eyes, constipation, weight gain, I mentioned that, insomnia, changes in mood, mood swings, allergies, anxiety, depression, fatigue, skin rashes, decreased immunity. All of these are symptoms related to increased toxicity levels. Now, let us look at some of the conditions. So remember I said the symptoms are simply the warning lights, but these warning lights speak to various conditions. And what we want to do is to deal with the conditions. In fact, one of the first things they told us in natural medicine is that you do not help the person by masking the symptoms. You help the person by going to the root of the problem, that is going to those conditions. So what are some of the conditions related to toxicity? Here we have a list again. Acne or eczema, asthma, colitis, diverticulitis, and that is one of the beginnings of colon cancer, where you have diverticulitis developing in the colon. Hepatitis, disease, high blood pressure, yeast and microbial overgrowth. You don't want to have yeast infections staying there. You could see it in your fingernails, in your toenails, on the tip, on your tongue, and so on. You can see those external examples or symptoms or representations of yeast buildup in the body. Then there's PMS problems in women, bronchitis, drug addiction. Believe it or not, drug addiction is a sign of chemical toxicity, neurological issues, kidney disease, diabetes, migraines, and various forms of headaches, gallstones, gout, ulcers, varicose veins, fibroids, cancer, autoimmune conditions such as arthritis, that is rheumatoid arthritis, not osteoarthritis. Osteoarthritis is different. But rheumatoid arthritis is an example of an autoimmune condition. Brain fog. Okay, so all of these are examples of conditions that are related to toxicity. So once the body is kept healthy, it means you have less of a chance of developing these conditions. So we come now to zero in on the topic for tonight. All of that was just setting background. So remember what detoxification is. It is simply following the body's natural pathways to rid itself of disease. Okay? And notice what we are showing you in this picture. A picture is words. You do not see any medication in this picture, but you see medicine. Because our father of medicine, Hippocrates, said, let food be thy medicine and thy medicine thy food. And so that is what we need to do to detox. So what is detoxification? Now, question. So detoxification is the body's natural ongoing process of doing three things. What does it do? It neutralizes, it transforms, and eliminates toxins from the body. So detoxification, therefore, has a three-pronged approach. It is engaged in neutralizing, transforming, and eliminating toxins from the body. And these all result in clearing excess acidity, mucus, and congestion from the body. Those are the three main causes of toxicity, inflammation. We have acidity, what is referred to as chemical acidosis, and then there's mucus buildup, which, as you would have heard from the likes of guys like Dr. Sebi, the late Dr. Sebi, he would have stressed a lot on mucus as being one of the main culprits in sickness and disease. And then there is congestion of one form or another in the system. So, antioxidant nutrients such as vitamin C and vitamin E. Then there's beta carotene, which is the precursor to vitamin A. In fact, I usually say to people, whenever you think detoxification, you have to think three vitamins. I refer to them as the ACE vitamins, that is A, C, E. And then in addition to the vitamins, we have other antioxidants such as zinc and selenium. All of these help to neutralize free radical molecules. So the first thing we want to do is to neutralize those free radicals. And it is the antioxidants which neutralize the free radicals. So the ACE vitamins along with zinc and selenium. And then the liver comes into play here because the liver transforms many toxic substances into harmless agents that are then carried away from the liver to the kidneys where they are excreted. The liver also sends waste via the bile into the intestines where they are eliminated. So recognize the antioxidant take care of neutralization, while the liver, along with the bile, takes care of transforming and eliminating. So the toxins are also eliminated by the sweating or by expelling mucus when there is congestion. So you don't want to swallow back that thing, but you need to cough it up and get rid of it. I'm not saying go and spit in the street, but you discard it in a proper sanitary way. Mucus builds up in your nose, you want to just blow it out, get rid of it. Okay, you don't want to keep it there. But remember, I said sweating is also a means of eliminating toxins. So the main elimination organs would be your intestines, your lungs, because you breathe out toxins, your liver, and your skin. Those are the main detoxification systems. And so here that was a nice segue into looking at the general detoxification systems. So again, a picture is worth 1,000 words. And so here we have the main detoxification systems. We have the respiratory system, and the lungs would be the main factor here. So we're looking at the lungs right here. These help to get rid of toxins via the air passages. And then there's a gastrointestinal system. So the intestines play an important role in helping to excrete toxins coming from whatever foods we eat. Then the urinary system, remember we said some of those toxins come from the kidneys, come from the liver via the kidneys out through the urinary system. And then we also have the skin, which is an emunctory system. Emunctory meaning gets rid of waste. And then there's the lymphatic system. We have the lymph vessels all over the body. And it is so good to do a general massage every now and then, because when you do that general massage, you actually help your lymphatic system to get rid of toxins from your body. So we filter and clear toxins and waste constantly through our general detoxification systems. So all of those systems come to play in getting rid of toxins from the body. Okay, so here we have the list in more detail. So remember, we said the respiratory system includes your lungs, the bronchial tubes, your throat, your sinuses, and your nose. So all of those form the respiratory system, and they help to get rid of toxins through the air passages. The gastrointestinal system comprises your liver, your gallbladder, and the colon, while the urinary system comprises your kidneys, the bladder, and the urethra through which the urine passes to get out of your body. The skin consists of your sweat glands and also the tears. The tears from your eyes actually help to get rid of toxins as well. So a good cry now and then makes sense, okay? And then the lymphatic system includes all of those lymph channels and the lymph nodes. So anything that helps us eliminate will help us to detox. So make sure you keep all of your elimination systems in good health. Just to share some other information with you, 80% of the detoxification process is actually done by your liver. Remember I said a while ago that your liver is your main detoxification organ. Soluble, fat-soluble toxins into water-soluble chemicals that could be excreted. I'm going to show you the process in a few minutes. Proteins and other natural substances also carry toxins out of the body. And those toxins are then eliminated through the urinary system in the form of urine, and they also eliminated through your skin in the form of perspiration. And that is why it is so important to drink an adequate or a sufficient amount of water every day, because that water helps the detoxification process. You don't drink enough water, you don't perspire, you don't get rid of that waste. You don't drink enough water, you don't have enough urine passing out, you don't get rid of the toxins. So it's important to drink an adequate supply of water. And then you want to eat healthy organic foods because they provide the nutrients that are necessary to ensure that detoxification occurs as it should. Remember we said you need those nutrients such as the antioxidants, your vitamins, and those important minerals that aid the detoxification process. So let's take a look at the detoxification pathways of the liver. And I'm just going to use my cursor here to go through the process with you so that as you look at the screen, what you are seeing here, toxins, which are fat soluble, enter the liver in step 1. And they go through into step 2. And then they are converted to waste products. Now in step 1, a number of nutrients are required. So that in step 1, we need the B vitamins, we need folic acid, glutathione, we need antioxidants, and milk thistle is a very good example of an antioxidant which helps the liver to convert those fat-soluble substances into water-soluble substances. Then there are the carotenoids, which form the A vitamin, then vitamin E and vitamin C. Okay, so all of these nutrients are required. Other nutrients that are required include the amino acids such as glutamine, glycine, taurine, and cysteine. In addition to that, you need what are called sulfurated phytochemicals, and these are found in garlic and in cruciferous vegetables such as your broccoli, your cauliflower, and your cabbage. Okay, so these foods are good for you. Now, when we speak about the toxins, here are a list of toxins. You have metabolic end products, microorganisms, contaminants and pollutants of various forms, insecticides, pesticides, food additive, drugs, alcohol. All of these toxins find their way into the liver, and the liver toxins, so that they go through the detoxification pathway, and they are converted to water-soluble waste products, which are then eliminated from the body through two different pathways. The first pathway is via the gallbladder down to the intestines in the form of bile, and then out of the intestines as a result of the bowel actions. The second pathway is to go via the kidneys into the urine, where they are eliminated. So those are the two main detoxification pathways, from elimination pathways from the liver via the bowels or the urine. Okay, so you recognize how important the liver is, and that is why it is so important to keep a healthy liver. In fact, that is why I cannot speak about the liver without saying to individuals, stay away from alcohol, because alcohol actually destroys the liver. We have what is called cirrhosis of the liver, which is as a result of consuming too much alcohol. That destroys the liver, that prevents detoxification from occurring, and so you end up with other problems as a result. Now, why do we need to protect the liver? I just mentioned the number one problem right here, which is alcohol. You see, daily life overloads the liver, leading to poor health and disease. Okay, I just spoke to alcohol intake. But then there are other things, excessive workload. There are some individuals who believe they are workaholics. And I have to pause here and confess that I believe I was like that at one time. I think I am getting control of that now as I age. but but I remember people used to say to me, Lincoln, you need to slow down. You're going too much. You're going too much. Okay? So overwork is a problem. Smoking is also another problem. We are just going around the clock. Smoking is another problem which impacts the liver. Prescription and over-the-counter medicines, believe it or not, these medicines which pharmaceuticals tell you are good for you actually cause damage to your liver and make detoxification more difficult. Yes, they are supposed to be medicines, but believe it or not, they are toxins. Read my lips. Pharmaceutical drugs are toxins. They were not designed to be food. Food is our medicine. And then there are various forms of infections and illnesses, whether acute or chronic. They could have a negative impact on your liver. Stress, whether it is physiological stress, psychological stress, emotional stress, you name it. Stress impacts your liver. Hence the need to cleanse your mind of all those things that create stress. And then there are processed foods, sugar, white flour products, you name it. They all have a negative impact on your liver. Environmental toxins such as heavy metals and pesticides, they affect your liver. Um, in New Zealand, you see this thing says NZ soils. This means New Zealand soils. They are deficient in key detoxification minerals. And there are some areas around the world that might have soil that are similar to the New Zealand soil, meaning soils that are devoid of the important detoxification minerals. And so when you have that, it means the food that is growing in those soils would not be able to absorb the necessary detoxification elements. And so again, the liver would be impacted because you're not feeding it with those nutrients that it needs to carry out its detoxification processes. allergies and food intolerances also have a negative impact on the liver. And then there's poor nutrition, poor eating habits impact your liver. And finally, coffee and other energy drinks. They have all kinds of energy drinks that they provide people with now, from Gatorade to certain power drinks. And the athletes go for those because they give an energy boost. But while they boost your energy, they're also destroying your liver and preventing it from carrying out its important detoxification function. So remember, your body is what we might want to refer to as your Department of Health. Okay, it is your sanitation factory. It helps to get rid of those waste from your body. So you don't want to overload your liver by stressing it out. You want to take care of your liver. All right. So having done that, now let us look at some of the benefits of detoxification. As I said earlier, toxins are all around us, in the environment, in the air we breathe, in the foods we intake, in the things we touch, even in the clothes we wear, in the furniture we have in our homes. It's all around us. So we cannot avoid getting toxins into our system. And over time, they accumulate and they create what is referred to as a toxic burden on the body. And that build up leads to dysfunction in your system. It leads to illnesses of various forms, and that is why it needs to be cleared out of our bodies. Hence, the importance of detoxification. So, let us look at some of the benefits of removing this toxic burden or this toxic load from our bodies. What are some of the benefits? Benefits include clearer skin. I think some time ago, I actually held my hand up and I showed you my skin. You can see my face. If you were to remove the hair, you could see the clear skin there. And I'm not saying this to be conceited or to boast, but what you put inside shows up on the outside. There is that radiance that people will see when you feed your body with the right foods. Okay? So not only do you have clearer skin, but you have a proper balance of hormones. Especially ladies, we every so often we hear the ladies complaining of hormone imbalances. One of the main reasons is because of the high toxic burden, and that is based on the toxicity of the foods that are consumed. Another benefit is regular bowel movements. Or every so often, I have clients come to me who complain of constipation. Some individuals tell me they have a bowel movement once or twice per week. But guess what? They eat 3 meals per day and then they snack in between. So if you're eating 3 meals per day and snacking in between, how come there's only 1 bowel movement or 2 bowel movements per week? No, there should be at least 1 or 2 bowel movements per day. If you can make it 3, that's great. But at least 1 or 2 bowel movements per day. Okay? You will see improved digestion of your food because you're putting in the right foods. You would have the right amount of fiber and the food will be digested properly and the waste will be eliminated effectively. Then you will see improved immune function. Your immune system will kick in and it will do the work that it is supposed to do, warding off diseases. You will have increased concentration, increased clarity. You will find that the brain works better, the fogginess will be gone, and your cognitive level will just improve. You will have fewer aches and pains. It is because of the acidosis why people experience so much pain, the joint pains, the muscle pains. That is as a result of the buildup of lactic acid in the muscles. So you'll have fewer aches and pains when you detox. You will have improved energy, believe it or not. Instead of feeling weak, you will feel energetic. And then there is some degree of weight loss. Mark you, detoxification is not necessarily a weight loss program, but there will be some degree of weight loss because you're getting rid of the toxins and the excess fats and so on, which hold on to those toxins. Okay, so those are some of the main benefits of detoxification. Now we want to look at some of the nutrients which support detoxification. In fact, research has shown that these nutrients which I'm presenting here benefit the functioning of those organs that are involved in the detoxification process. So, one of the main nutrients is magnesium. Yes, that's an important mineral. You get that mainly from your greens. Okay, you pack up with your lettuce and your spinach and your kale and your parsley, your celery, you name it. All of those greens are packed with magnesium. And then there is the selenium. Remember, I mentioned selenium a while ago as an important antioxidant, which works along with zinc, okay, to help with the neutralizing of the toxins. And then there's what we call indole carbinol, the B vitamins, N-acetylcysteine, glutamine, these are amino acids. Then there's quercetin, which is found in the onions and the garlics and so on, and asparagus. And then there's fish oil. And you don't want to use any old fish oil. You want to use fish oil that comes from fish that are not fish that are farmed, but fish that are found out in the wild. Deep sea salmon, for example, and all of those deep sea trouts and so on, will give you good fish oils. And then the probiotics that you use to help to get rid of the harmful bacteria in the system and replace the good bacteria. So all of these are nutrients that actually help to support the detoxification of the body. Some other nutrients, the herbs now. So you have the beneficial herbs, and these are very good for the liver. We mentioned milk thistle a while ago when we were looking at the liver pathways, the detoxification pathways in the liver. So milk thistle, dandelion, very good liver cleanses. Artichoke, neem. I'm sure you would have heard about the neem. It's such a wonderful plant, antiviral, antibacterial, antimicrobial, antihistamine. It is anti all kinds of things, and almost every part of the neem is very beneficial. If you don't know about the neem, you can just Google it. A lot of information is there online. And then there is senna, a very good laxative, which also aids in the detoxification process. And then there are the beet greens. Oh, lots of folks eat just the beets alone, the vegetable. But the greens are excellent, right? Just like how you cook greens in your rice. Some people cut up the greens and cook it in the rice, or they saute it and use it. The beet greens are excellent because it is packed with nutrients that help in the detoxification process. So you now know you don't need to throw away the beet greens anymore. Garlic, turmeric, ginger, all of these, cilantro, that's a chelator. So it helps to form that um, what we call a time capsule effect, covering the 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 nutrients so that they are released slowly in the system. And then you have parsley as another very good detoxification agent. Okay, so all of those herbs are very beneficial in the detoxification process. Okay, so we come now to the last section where we look at some general guidelines um, for detoxification. Okay, so this is just to give you some advice, give you some help, give you some guidelines, some guidance, some tips, and so on. All right, so that is what this section is for. Okay, so let's look at the main features of a detox. Detox actually occur through dietary and lifestyle changes. For your detox to be effective, you have to make dietary changes. It does not make sense um, pouring water on the fire, but then throwing some gasoline with it. Hello? The alcoholic or the smoker will tell you, just tell me why it's good for it, and I will use it. So they tell them what is good. They're using it, but they're still drinking. They're using it, but they're still smoking. Doesn't make sense unless the lifestyle changes. Okay? Um, what detoxification does is it helps to decrease the bad bugs, those free radicals, those toxins which build up in the system. It helps to re-inoculate your body with the good bugs. So, for example, think in terms of harmful bacteria and harmless bacteria. So, detox helps to get rid of those harmful substances and replaces with the good substances. Detox also improves your digestion, as I said earlier, and then it increases the speed with which your body removes toxins. So, that's why detox is good. Okay? Who should engage in detoxification? Sorry, who should not? My bad. Who should not engage in detoxification? Because you see, we have to recognize that there are certain medical conditions, certain health conditions, which might prevent you from engaging in detoxification. One, if you are anemic. So if you're suffering from anemia, you don't want to engage in detoxification for the simple reason that you need to keep your nutrient levels up. Okay, you need to eat adequate amounts of food so that you can feed your blood to provide your body with the nutrients it needs. Because remember, if you're anemic, you have low blood cell, red blood cell counts, um, um, less oxygen going into the system. The person who is anemic gets tired very easily, and so you don't want to labor the system by doing a detox. People who are suffering from cancer, if you're suffering from heart or liver disease, if you are pregnant or breastfeeding, you should not really engage in detoxification because you want to be providing, that developing embryo or that newborn baby with the nutrients it requires. If you're on medication, you would want to be careful about detoxification. If you suffer from what is called chronic fatigue syndrome, or if you have multiple sclerosis, so all of those are medical conditions that would prevent you from engaging in detoxification. If you are elderly, um, you don't want to engage in too much detoxification, because you see liver circulation increases, decreases with age. That is the movement of things to your liver, nutrients and so on, decreases with age. Those nutrients will not be able to pass through as easily as possible. Now, having said that, I I have to confess that even at my age, I still detox. In fact, right now, I am actually in the middle of one of my um, detox sessions. Okay? I'll tell you about it in just a few minutes. But if you look at the list, I have a note here in red that says, this list is not absolute, so that these persons may be allowed to carry out a detoxification under the supervision of a medical professional. Okay? So the point I'm making is that I would not encourage anybody who has any of these conditions listed here on your own. But if you feel the need to detox, then you would want to make sure you do it under the supervision of a medical professional. So you would understand, doctor, I feel that I can still take care of my own detox. Okay, what to eat on a detox? Now, what you are allowed to eat while detoxing is to some extent dependent on the goal of your detox. What is it you are attempting to do? Because you see, there are various types of detoxification interventions. For example, do you want to address the source of migraines? You might have certain food intolerances that might be leading to the migraines. And so you want to do a detox to get rid of those. You might be suffering from eczema. And so you want to do a detox to get those toxins out of the skin. You want to establish new eating habits. And so you want to do a detox so that you can make that transition from poor eating habits to good eating habits. You might want to engage in weight loss. And so there's a particular type of detox which would be specific to weight loss. Then there would be specific toxin detoxes for example, nicotine or aspartame. If you have lots of that in your system, there are specific detoxes for that. There are detoxes for digestive distress, such as bloating or gas, acid indigestion. There are detoxes for various types of allergies, you see. So that what condition you are wanting to take care of is going to determine the type of detox you would want to do, okay? And there are detoxes that are specific to various organs of the body. So there is a liver detox, there is a kidney detox, for example, there is an intestinal detox, you name it. So there are detoxes for various parts of the body. Now, the detox diet is ideally tailored, is ideally tailor-made for each patient or each client, again, depending on your personal health goals, okay? Yes, there are some forms of detox that are general, that anybody can do, but what I'm saying is there are specific ones that are tailored to your particular needs. Some proteins that one can eat on a detox would include beans, poultry, or even fish, okay? If you are doing the type of detox that allows you to eat food. Some grains would include gluten-free grains, such as quinoa, or brown rice, or millet. You would not want to use wheat on a detox diet because, wheat contains gluten, okay? Um, so for some, um, we'll have to do a wheat-free diet, okay, because of the gluten, as I mentioned. Then there are some vegetables. Now, all vegetables are okay except for tomatoes, corn, egg white, I'm sorry, white potatoes, mushrooms, and eggplants. Okay, my brain was going faster than my tongue. That's why I ended up saying egg whites when I was going to say white potatoes. So all of these are not supposed to be included with a detox. Okay, um, fruits again, all are okay except bananas, oranges, melons, and dried fruits. Okay, you don't want to use those during a detox. Now, there are some detoxes that you can end with orange juice, okay? But you don't want to be using the orange juice during the detox. No caffeine, no alcohol, no sugar, no dairy, no eggs should be used during a detox. And no peanuts, no vinegar, and in some instances, not even soy. You would see the question mark there by it because the verdict is still out on soy, but there are some schools of thought that dictate that soy should not be used during a detox as well. Okay? So, what are some of the supportive techniques for detox? I'm just listing a few here for you. Deep breathing exercises. That is so important because you want to get that rich supply of oxygen into your system. Okay? So you want to do deep breathing exercises during your detox. You want to make sure you get good night's sleep, at least 8 to 10 hours. I still find I am not able to get that many hours of sleep, but I do try my best. In fact, today I lay down for practically most of the day, but I did not sleep since I woke up this morning. You know, even though I am in the middle of a radical fast detox, I'll tell you that. Dry skin brushing, as you see the lady here, um, that helps to improve your lymphatic movement and also helps to get rid of toxins that might be on the surface of your skin. Then Epsom salts are important as well, um, because they help to get rid of muscle aches. 2 to 4 cups of Epsom salts in a bath would work excellent. Then you have castor oil packs. So you could put castor oil packs on certain parts of your body, warm castor oil packs, and they would help to increase circulation and also help to promote elimination of toxins from the body. And there are some good oils you could use. Lavender oil is one. Even cold, wet socks are good to wear during that detox um, period, help to get rid of toxins from the body. So those are just some of the techniques that you can use to support your detox. Okay, so let me just zero in on some actual um, techniques. The first one I want to introduce you to is what is referred to as the master cleanser or the lemonade diet. Some of you may have heard about it before. The lemonade diet was developed a good while back. I don't remember the year, but was developed by Dr. Stanley Burroughs. In fact, you can actually go online and search for the master cleanser. We have all of the ingredients here. As I said, it is called the lemonade diet. And let me just run by it for you quickly. It includes um, a book. The book is called The Complete Master Cleanse, and that explains the whole diet. Um, the main ingredient is here, the lemons. Okay, remember I said it's also called the lemonade diet. That's the main ingredient. You use maple syrup along with it and cayenne pepper. So those are the three main ingredients in the diet: lemons, maple syrup, cayenne pepper in natural spring water, not tap water that contains chlorine and other contaminants. It has to be purified water. On the side here, you see sea salt. The sea salt is used as a flush. Every morning, you drink 2 teaspoons of salt in um, in a quart of water. I almost said 4 quarts, 4 quarts a gallon, but I was going to say 4 cups. 4 cups or 1 quart of water, okay? And that flush is done first thing every morning. And over here, we have peppermint tea, which you can use. I think um, this is a laxative, which you use at nights just before going to bed. The one I use is senna, okay? And I use senna mainly during, for the first 2 nights of the detox, because after the first 2 nights, you don't have a lot of stuff in the bowel to move anymore. You simply use the salt water at mornings. The peppermint is to be used as a tea. For example, in the evenings, if you find you have stomach aches or maybe a little headache because of the fact that you're not eating food, because the lemonade diet is just as it says. a lemonade diet. So you consume nothing else but lemonade. Okay? So as I said, the lemonade diet or the master cleanser designed by Dr. Stanley Burroughs. And what it does, reason it's called a master cleanser is because it's a whole body cleanse. It is not just a liver cleanse or a kidney cleanse. The liver cleanse focuses on the liver. The kidney cleanse focuses on the skin. The intestinal cleanse focuses on the digestive system. But the master cleanser focuses on the whole body. Okay? So you eliminate toxins and congestions that have formed part of the body. Sorry. Hello?
You still live, sir.
Oh, okay, yes. So the congestion that have formed in any part of the body, it cleanses the kidneys, the digestive system, it purifies the glands, it purifies the various cells of the body. What it does is it cleanses your body. So that's what the master cleanser does. And that's one of the reasons I fell in love with it. In fact, when I started it, I actually did it twice per year for a full 10 years. I have not done it in quite a while now. So in fact, I shifted to the liver cleanse a couple of years ago. And I have just decided to go on the lemonade cleanse again, the master cleanser. So as I sit here speaking with you tonight, my last meal was last Saturday. That's what, over 8 days ago? Yeah, today would make 8 days, right? Yeah. So I actually started the lemonade diet last Sunday. So for the past 8 days, I have had nothing else but lemonade. And that will be going on for the next few days. Okay. In fact, my first meal is going to be on Friday, and it would be just a small bowl of soup, blended soup, more like liquid, because I wouldn't be able to put solid food into the system right away. You see, I would end the fast on, I was going to do it for a full 2 weeks, but I'm going to do the minimum of 10 days since I have not done this one before. So the 10 days will end on Tuesday, and then I have to spend 2 days drinking juice. That would be Thursday, Wednesday and Thursday. And then by Friday, I start consuming food again, but in liquid form. So I will have soup for 2 days, Saturday and Sunday. And then by Monday, I'm back to solid food again. So that's the master cleanser, ladies and gentlemen. A very good cleanse, but it takes some preparation. You have to be mentally prepared for it. Let me give you a little story. I'm going to tell a tale on myself. When I did it the very first time, early in 2002, as I said, the minimum is 10 days. By the time I got to day 3, I began to feel sick. Day 5 was trouble. Day 6, I was like, I can't do this anymore. I said, you know, I need to get something in my system. And I left home, went to the supermarket. I thought of something simple. I decided to buy some breadsticks. And I came home with those breadsticks, and I decided I'm not going to chew them, but I'm just going to soften them in my mouth and just suck the nutrients out of the breadsticks. Who told me to do that? Let me tell you, shortly after that, I was, as the old people would say, sick like a dog. I ended that cleanse on day 7. So I did not even make it to the minimum of day number 10. And I beat the rest of that. And then later that year, it was about October of that year, about February in the year, and then about October, if you're doing it twice per year. Okay? If you're doing it once per year, it's best to do it like, you know, after the winter when you're going into spring, because it's like you're cleansing the system. we're doing a spring cleaning. All right. But after that, every other one was perfect. I went 10 days the first time. Then I went up to 2 weeks. I did 2 weeks for quite a while until I got 6 weeks. And so I did 21 days quite a few times. Nothing else but lemonade. And on day 21, I felt as energetic as if I had eaten food that day. So it works. It works. All right. Then there's another one for those of you who might say, oh, just drinking lemonade alone is too much. I need to eat something. There is the grape cure. So you can do the grape cure. It's what is called a mono diet, meaning you're only eating one kind of food. So you could do a grape cure. It's highly effective for self-cleansing with little effort. At least you can eat something. And all of the emunctories, remember I mentioned the eliminatory organs as emunctories. So all of them are involved, okay? So your skin is involved. So your complexion lightens rapidly. Your skin is purified. The kidney and liver drainage is deep, but unaggressive because you are using food material. The intestines are able to regenerate. You are able to soothe your intestines of that fermenting and the putrescence which is there. Because let me tell you, you'd be surprised at what builds up in your intestines. Do you think when you have a bowel movement that everything in your intestines comes out? Mm-mm. There are some individuals who actually do a kind of withdrawal of waste from your intestines. And you'd be surprised to see the tarish black stuff that comes out of the lining of the intestines. And that stays in there, clogs up the intestines, and absorbing the nutrients effectively. Okay? And then the fiber which is in the grapes also give you a kind of light cleansing because the fiber helps to move toxins out of the intestine. Okay? And by the way, that is exactly what the salt water does. So first thing every morning, I drink that quart of salt water, and what it does, it dissolves all of that stuff from the walls of the intestines. So by the time the fast is done, the walls of your intestines are nice and clean. And you go back and you have, regular eating, and you're absorbing all of the nutrients that the body needs. Oh, yes. And then there's what is called the healthy or Alpha Detox program. Now, the Alpha Detox program is actually a 4-week program. So for anybody who wants to get on that program, you have to dedicate a month to that. The first is called an initial comprehensive consultation. So you recognize that you'll be doing this with a healthcare provider. And in most a naturopath or well, even some dietitians may be trained in that area if they would have done that aspect of it, cleansing. But usually a naturopath is someone who would do this kind of thing. So during that visit, time is taken to gather information about your personal health, past as well as current health. Then there's a body composition analysis that will be done to provide some baseline values on which you can base your future goals, okay? And the body composition analysis is an excellent tool. Individuals are surprised, when I do that body composition analysis for them. And one of the things it actually does, it tells your actual age. If I were to ask one of you your age, you would say to me, oh, I am 25 or 35 or 45, as the case might be. That's your chronological age. But your actual age is what is referred to as your metabolic age. That is the age of your body's cells and tissues. And surprisingly, I have had individuals come to me whose metabolic age is sometimes 10, 15, or 20 years more than their chronological age. Imagine that. And for some individuals, you can see it in the body. You know, you ever say to yourself, but the person looks so old for the age. What you're seeing is the metabolic aging. On the other hand, an individual who is very healthy and fit would have a metabolic age that is years younger than their chronological age. For example, when I was about 64, my metabolic age was 42. Now I'm 68, my metabolic age is 48 or 49. It varies around there. You know what that says? That the body is aging slowly. So barring accidents, you know, I could probably look for a long life, you see. And that's what you want. You want your metabolic age to be much lower than your chronological age. And you do that by keeping a healthy internal environment. So that's why detoxification is so important. So in this Alpha Detox program, during the first week, you do what is called the 7-day reduced sex diet. It's a special diet that allows you to eat certain kinds of foods. So for that first 7 days of the program, the BioClinic Naturals 7-day reduced sex will be used. And again, that's a specific program which the naturopath will provide for you. It is a 1-week intensive nutritional detox designed to achieve 3 hours removal, renewal, and release. So it removes toxins, it renews your system, it helps to release your good energy. Okay, that's what it does. So removal treats the digestive system to remove bad bacteria and waste from your digestive system. Renewal focuses on your kidneys, alkalizing your body. And that helps to support the detoxification and elimination functions. And then, as I said, the release, what it does now, it provides your body with the nutrients required for successful liver detoxification, and that in your body throughout the elimination process, okay, so that you could release the toxins more effectively. Now, during weeks 2 to 4, you replace on what is called a hypoallergenic diet. And what that does, it's a therapeutic diet based on the research and clinical successes of many naturopathic as well as some medical doctors who have taken on the naturopathic philosophy. And so that diet will help you become more aware of and discover those foods that optimize your individual health and the functioning of your body, okay? And during that phase, you will follow a diet that excludes the most common foods that are shown to cause allergens. So referred to as an elimination diet because it helps you to eliminate those foods that cause allergies and other forms of intolerances. So in general, these foods are hard to digest and they have a high allergenic potential. And so you want to get rid of those foods from your system. So those are just 3 examples of detox programs that you can use. In fact, when I mentioned the mono diet, I mentioned grapes, but you can use other kinds of fruits. For example, the mango is also a good food for a mono diet because not only is it packed with nutrients, but it is also packed with fiber. So just like the grape, it will provide the cleansing as well as the nutrients. In fact, when mango is in season, I eat lots and lots of mangoes. When it's especially grafted mangoes. Okay? Just the other day, my wife came home with a bag of mangoes. And she was like, oh my, Lincoln, it's only when I reach the... And I'm like, all I could do is watch those mangoes. because of the fast. I'm on the lemonade diet, so I couldn't eat mangoes. That was it. Anyway, folks, it's now your time. Okay, it's now your time. So I'm sure you might have questions, you might have comments. So I'll give you time to raise your questions or comments.
Wonderful. Very informative, Dr. Carty.
Thank you.
Oh yes, this I really enjoyed this session, and there are a few questions. I see two questions that are not concerning detox.
Oh boy.
Yeah, two questions. They are not concerning detox, but I don't know whether I should ask them first and then or ask them last.
Well, if since they came up, let's
Okay,
ask them at the end.
first person on Facebook, she asked, "Is there a cure for sickle cells?"
I am not certain, for the simple reason that sickle cell anemia is genetic. And because it is genetic, then um, I am not certain that there is actually a cure for it. But there are some things that one can do. Um, and one of the main things is to try to increase your level of iron in the body. You don't want to overdo it because remember I said earlier, too much of anything could be toxic. Okay, so iron supplements as well as spinach and spirulina. Spirulina and spinach are two very good sources of iron. So that is what the individual can do and follow whatever advice you get from your healthcare professional. So that's my take on sickle cell anemia.
Okay. Yes. The other question is, I need something to help me with sinus. The other person said she needs something to help her with sinus.
One of the first things which comes to mind quickly is to boost your immune system. Remember we said in this presentation, and that relates to detox, because remember we said earlier that sinus problems is one of the conditions which results from toxins in the system. And so you would want to focus on a general and you boost your immune system. And how you boost your immune system again, the ACE vitamins A, C, E. In fact, a good immune system booster that I recommend to my clients is um, day booster of vitamins and some minerals like vitamin A, 50,000 international units per day for 7 days. After that, you can go back to the normal daily intake. But for an immune booster, international units of vitamin A per day for 7 days, 1,000 milligrams of vitamin C per day for 7 days, and um, about 400 international units of vitamin E per day for 7 days. Um, that's the ACE. And then you can add to that um, echinacea and golden seal. That's a combination of echinacea and golden seal. Shiitake mushroom, if you can find it locally in your health shop, or you can order it. There are lots of supplements now that are sold online, so you can order it online. And then I mentioned zinc and selenium because those are very good antioxidants. So that in combination will give you a good immune booster. Vitamin A, C, E, zinc, selenium, shiitake mushroom, echinacea, and golden seal. And for those, you just use them as directed on the containers. Okay, so once you boost, and in fact, I also recommend that immune booster even for individuals suffering from asthma. Okay, as a quick immune boost, and then after that, you can go back to the regular daily amounts to continue.
Okay,
Okay?
great.
But you want to use your antioxidants regularly.
Okay. Another question, how long should we detox?
Again, it varies, depend on the need. Now, if you are going to do the lemonade cleanse, the minimum recommended is 10 days. So if you're going to do that lemonade cleanse, you cannot say, well, I'm just going to do 3 days and stop. You're not going to get the full effects of that cleanse under 10 days. Okay? You can go to 14 days, you can go 21 days, as the case might be, as I have done quite a number of times. Okay? The grape cure is a 5-day cure. So if you're doing a mono diet, it's 5 days. So it just, and remember I mentioned the hypoallergenic diet. That's a whole month, 4 weeks. So it just depends on the type of cleanse you're doing and also on the goal. If you're doing a kidney cleanse or a liver cleanse, that could take anywhere between 3 to 6 weeks. You start with a 5-day protocol and then you continue after that. Okay, so it varies depending on the needs and the goals.
Okay. There is another question. Do people with ulcer need to detox?
Ulcers. One of the first things you need to do is to fix that problem. So you would have to first get rid of the ulcers. Okay? And um, one of the ways to get rid of ulcers is to get rid of acidity from the system. That is, you want to eliminate acid forming foods and you want to alkalize your system. And when I say alkalize your system, I'm not talking about using antacids, because antacids in themselves, while they might be alkaline, those actually make the problem worse. If you remember when I was speaking to the topic acid indigestion, I mentioned the fact that a lot of those antacids which people use actually cause the acid indigestion to get worse. Okay? So what you want to do is to get rid of acid forming foods such as um, dairy products, sugar, alcohol, meats and sodas. Those are main acid forming foods. And you want to use alkaline foods. So the fruits, the vegetables, the grains, and so on. These are what you would want to do. Okay? Get rid of high sugar drinks, high fructose sugar drinks, and so forth. Okay? Use herb teas without sugar or natural juices. You see, in and I have to say here, probably in addition to what medications you might be using from your pharmaceutical sources. However, let us just stick a pin here and say that there are a group of medications called NSAIDs. The common name for them are painkillers, like aspirin, Tylenol, ibuprofen, paracetamol, you name them. Those drugs actually help to cause ulcerated stomach. They cause ulcers, they cause throat problems, they cause mouth problems, believe it or not. And there are some people who just guzzle down painkiller. The little finger hurt them, they grab a painkiller. There are some individuals who have painkillers living in the homes with them. And so every little thing, even a stomach ache, you take a painkiller. So you can order it online. And then I mentioned zinc and selenium, because those are, I'm getting a playback here, believe it or not. And there are some, okay, I think I'm hearing myself being played back. Okay, so yeah, so that's just the quick answer to that question. Okay, you want to alkalize your system to help you to get rid of the ulcers. The ulcers are caused by acidity in your system. Okay. Yes. Any other question?
Yep. Other question would be, would fasting without food and water, would it have an effect on detoxing, or is it a way of detoxing?
I noticed you said and water.
Without food and water. No food, no water.
No food, no water.
Yes.
Do you know what happens when you do not drink water?
You dehydrate.
The body dehydrates. I would not recommend any fast without water. I would not recommend that. Because even though the fast is intended to cleanse your body, you also have metabolic processes taking place in your body. And those metabolic processes require a liquid environment. A fast without water is radical. And I am not sure that I would want to agree that that is what was intended for us in this modern age. I am not certain I would want to agree to that, okay? Especially in light of the fact that it is so easy for the body to become dehydrated. You'll be surprised at the amount of water we lose from our bodies on a daily basis. Even in the presence of air conditioning. People feel cool in an air conditioned room. They're not sweating. But believe it or not, a lot of water is being released from your body through your skin in an air conditioned room. And so I always have to remind people who work in air conditioned offices, that is when you have to even increase the amount of water you consume. Okay? Yes, you can fast without food, but certainly not without water.
Yeah, the air condition, that was my follow-up question.
Yeah.
You answered it. It is would air condition, working in air condition, have an effect, or would cause you to need, would it be a disadvantage? Would it cause you to need detoxing, or what how does it what effect does it have on detoxing?
Yeah, because not only does it dehydrate the system, but there's a certain amount of electromagnetic radiation associated with air conditioning units. Okay, and then um, what happens too is that the air is not as pure as you would want it to be. Okay, that's why it is so much better to have your windows thrown open so that you have a good circulation of fresh air passing through. You see.
Yeah, but again, if in case, yes, you have the air condition on, and then you have your window crack up a little to
Okay, to increase the circulation of fresh air.
circulate the air little,
Yeah,
the
that
AC,
that
the air
that could
condition
help.
from the window.
Yeah, that could help.
Oh, all right. Yeah,
Yes.
great. Yes. Also, you mentioned the lead before. There was the PVC pipe. There used to be lead.
Yes.
They got rid of it. They have PVC. PVC. There are still disadvantages in using PVC.
Yes, because it's plastic.
Yes.
It does have.
Would
Mhm.
you say, because if you live in a house, it is not wise, even if you have a sink, it is not wise to just, every time you would need water to go to maybe the tap or whatever, although the water from the tap would not be the safest.
Right.
The containers that they sell the spring water or purified water, it is
Yeah,
plastic. It
that
is
is true.
plastic.
That is true.
Right. So most times they would be transported on trucks, and it's exposed to the sun.
Yeah, I agree.
Now, wouldn't it have an effect on that water, also, would
Mhm.
it be safer to store your water in metal containers, metal appliances, or whatever, and or glass?
Glass and clay pots, those are much better. Okay, glass and clay pots. But yes, we live in an environment where there are lots of plastics. In fact, I buy my water in plastic bottles. But um, one of the good things about my supplier is that his storage facility is very close to the port. And so the water is not exposed to the sun for a long period of time. And whenever I buy my water, I place it in my vehicle and head straight home because I do not allow it to stay in the car for any long period of time in the sun either. Okay? And one of the things I should say is that the plastic bottles for holding the water, they are much safer than in the past. Say about maybe um, 5, 10 years ago, because there used to be certain biphenyls in the plastics that were toxic, but they have removed those. You know, the EPA has put regulations on, you know, what could be in the plastics, okay? So they've removed them to make the water safer, right? Like I said, you know, we cannot escape the toxins 100%. And that is why detoxification is so important. So even though I personally strive to live a healthy life, I try to live, you know, I try to eat organic foods as much as possible. I try to drink, you know, purified water, but I still detox on a regular basis, you see, because of the need to ensure optimum health.
Okay, nice, wonderful. What's about the other question is what's about petroleum jelly, the to apply in the hair?
Petroleum jelly is one of a group of substances that are actually hydrocarbons. What is it made from? Fuel, right? So that the same compounds that are used for making fuel, well, notice the name, petroleum jelly, you see. And so that itself also has certain toxins which you would not want to put in your hair because then those toxins will seep through your skin and you never know what the impact could be. I know some of the ladies might say, well, I need something to keep my hair soft and so on and so forth. You know, I don't know the last day I put anything in my hair. And if you're able to reach to the screen and feel these things, you would be shocked. You know, little children like to play in it whenever they get close and they touch them because they're great, they're curious. But whenever they get that first touch, I usually look at them to see the effect, you know. They're so surprised because the hair is so soft, right? Yeah, they're like wool, you see. You don't have to put anything in them.
Okay.
But every now and then, I do a course of either coconut oil, olive oil, or a combination of both. I have not done that like in a few months now. And so, you know, in a little while, I'll go back and I'll do that for maybe about a month or two, and then that's it. You see.
Okay, so
And yes,
you would recommend coconut oil or olive oil instead of petroleum.
right,
Okay,
exactly,
yeah, that is nice. Yeah, that is
exactly.
great. Yeah. Also, another question came up. What effect does passing of air, so they call it fat, passing of air, whether it is a way of detoxing and whether it tells you that you need detoxing? Is the bad odor when you pass with the bad odor, whether it's bad or
Mhm.
good?
No, it simply tells you that one, um, you are eating foods that you are not supposed to eat. These are foods that cause the release of acidic gases. You remember we mentioned that when we were looking at some of the causes of acid indigestion. But it is also a sign that there is a good sized gap between your various meals so that there's a buildup of air in the intestines. And as peristalsis takes place and the undigested food behind it is released, then that air will be forced out. You see, so it's not really a sign that you need to detox. It's just as well, you know. You say one, you say two, as the old people would say, right? Because if you're eating the right kinds of foods, um, you would not have um, the flatulence, the putrescence, for example, that is caused, say, by fermenting proteins such as meats. You see what I mean? You would not have that. That is one of the reasons for the large gas buildup. Okay, and in fact you can smell it. Now, if you are on a plain good vegan vegetarian diet, the air that passes out is simply air that builds up in the colon, after some time. And it will not have much of an odor. So you can actually tell the difference.
Okay. Wow. Nice. Interesting. So we are from we. It is better to be vegan.
Much better. In
Yeah,
fact,
but
that's how we were designed.
oh yes, yes,
We were
indeed.
designed originally as vegans,
Yep.
but sin brought meat.
Yes.
And what really bothers me to some extent is that we were given a good variety of clean meats, but people are still craving the unclean meats. And then for some reason, they will tell you the unclean meats are sweeter than the clean meats, you know. And that's a trick of the evil one. You know how many people will tell you, oh, I can't stop eat pork? But that animal is an abomination. It's a scavenger. It is the scavenger of the earth. And if you believe in the Chinese adage, which says you are what you eat, then look at what happens when you consume the pork. Help us.
Mm.
Yahweh, help us. Yes, yes.
Oh, nice, nice, nice. Interesting.
But
Yes.
I should add something else to what I just said.
Mm.
It would be remiss of me if I didn't say this. Even though our Heavenly Father, in His love, gave us the clean meats to eat, today, in the 21st century, I warn people away from some of those clean meats, so-called clean meats. Why? Because man, in his foolish wisdom, has actually contaminated those meats. So while our Father Yahweh said, you could eat the cow, you could eat the mutton, the goat and the sheep and so on. While he said we could do that, look at what the farmers have done. Look at what Big Pharma has done. Look at what the industries have done. They have poisoned those animals. In fact, since you raised the question, let me see if I could find a book here. Hold on. Very, very important. Let me see. Okay, I got it. I got it. I want to just share. Sorry. I want to just share something with you guys very quickly. The book is called The 100-Year Lie. The 100-Year Lie. And let me see if I could find this. Listen to this. And now this quote is a quote from a long time ago. But it still happens today. Most of the nation's cattle spend their lives until slaughter. Grazing in open spaces, yes. Eating naturally occurring grasses, yes. And that went on until about the early 70s. However, what happened after the 70s? 3/4 of the US cattle will end up spending most of their lives where? In crowded feedlots. You go to the farms, you see where they keep the cattle. They are injected with antibiotics and hormones. And many of them are fed a diet that includes processed sewage, poultry litter, shredded newspaper, sawdust laced with ammonia, tallow, and grease. This is what cattle get to eat. And then those animals are slaughtered and sold to you in the name of beef. Now you understand why I do advise some individuals. That's for cattle. Let's go on. There's another one. Let me see if I could find the other one. The other one concerns poultry. Listen to this. The journal called Scientific America reports that the diet a chicken is placed on in poultry production is almost totally foreign to any food it ever found in nature. Its feed is a product of the laboratory. This diet includes antibiotics, hormones, sulfur drugs, and even arsenic. And I think I remember telling you all just the other day in a presentation some time back that the FDA was forced to acknowledge just recently that arsenic is still found in the feed of chickens. So even though chicken is labeled as one of the clean meats from Yahweh, today in the 21st century, it would take a lot for me to tell people, yes, go out and eat chicken, you see. So we have to be so careful. We have to be so careful. That's why we need to go back. We need to go back to the original diet.
Yep. Yeah. So yes, it is not safe to eat those animals that are reared by those farmers. But if we rear our own with
Correct.
just the natural old time way, it is
Yes.
safer. It is safer. Yes. Okay, that
Yes.
is nice. I see Dini has a question. Her hand, she has put up her hands. You could go ahead, Dini.
Okay. While Dean is asking a question, could I share my screen so to give my information for those who might need it?
Yeah, your screen is shared. Yeah.
Okay. Just for those who might need that information. Okay. Okay, so you have it there. Yes, Denny, your question?
Yes, sir. Yes, sir. I'm grateful for all the answers that you answered questions today and what you said. And actually one of my questions you already answered it. But
Yeah.
I have a question for nursing mothers. Like their babies are 2 or 3 years of age and they
Yes.
want to detox. But then they will be like, okay, if I detox, will it affect my breast milk production or babies? So what will you say about that to them?
No, detox does not impact breast milk production. Remember,
Mm-hmm.
this is directed by hormones.
Yes,
Okay,
sir.
so that what we say to pregnant or nursing mothers is that you don't want to be detoxing at that time, because
Oh,
remember the developing embryo needs optimum supply of nutrients.
uh-huh. Yes, sir.
The breastfeeding, the nursing baby
Mm.
also needs an optimum supply of nutrients. So if you're going through that fast, that detox, remember you are eliminating some nutrients from your diet. You see what I mean? And
Yes,
so
sir.
that
That's
embryo or that nursing baby could be impacted by the lack of nutrients.
mm.
Okay?
Yes, sir.
So that's why we do not recommend fasting or detoxification, to pregnant or breastfeeding mothers.
Thank you. That was part of my question because I was like, the worry would be like, what will happen to my child development and all of that, and you've answered it. So, even though it's controlled by hormone, the cutting off your nutrients affects your breast milk quality. Is that right?
Right, exactly.
Okay. Thank you so
That's
much for.
why that's why pregnant mothers are, encouraged to eat healthy.
Mhm.
You see.
And also that brings me back to vegan. I know I'm still in the vegan group, and people's worries are being pregnant because when I started vegan diet, somebody asked me, it was a male, and said, how can you as a woman start on vegan diet? What if you get married and you're pregnant? You need all the hormones. Not the hormones, sorry, you need not only the hormones, you need all the nutrients, or excuse me. So they were saying, oh, you need to eat fish or other things and meats. But what is your take on that, sir?
I have a quick response. What did the mothers eat before the flood?
Uh-huh. Vegetables?
Exactly. Remember what I said? Our
Yes,
diet
sir.
before the flood was a total vegan diet. Nobody ate animals.
True.
The population grew.
Yes, sir.
Exactly. And when I speak to people about vegetarianism, they always have that question. So where would I get my protein from?
Mm-hmm.
And my question to them always is, where does the horse get its protein? Where does the
Ah,
cow get its protein? Where
okay.
does the elephant weighs tons.
Mm-hmm.
Where does it get its protein from? Bush. You are a mere mortal just weighing 100 and something pounds, and you're worrying about your protein intake. You see what I mean?
Yes, sir.
These massive animals don't eat any meat, and they get all the protein they need for those massive muscles they have.
Mm-hmm.
So vegan still works. And
Yes.
they are mammals just like us.
Okay. Great. I have my answer next time. So when I return back, I got the ammunition from you.
However,
Yes.
however, caveat, because
Mm.
nutritional research shows that the vegan diet does not always supply you with an optimum amount of the B vitamins. That has been shown. I am not sure I understand why, but one thing I have found is that you can get a good supply, in fact, an excellent supply of your B vitamins from spirulina. Spirulina is a blue-green algae, grows on the surface of the water. Wherever it grows, no pathogens can grow there. The water is nice and pure wherever spirulina grows. And that is an excellent source of nutrients. In fact, spirulina is referred to as green gold. Yep. It's also referred to as aquatic ginseng. It is a powerhouse. I use spirulina on a regular basis. In fact, that's what I used to use when I was a long distance runner. Lots of folks didn't know that was my secret weapon. That's why I could run for miles and not get tired. Yeah. The only problem is that it didn't pay off because when I had my opportunity to go to the Olympics, I had a bad accident that stopped me in my tracks. In fact, yesterday I celebrated the 26th anniversary of that accident.
Wow.
Happened in 94. I was supposed to go to Atlanta in 96 to run in the Atlanta Games. I was supposed to run the full marathon in 96 at the age of 43. Imagine that. And that accident totally took away my dreams. And I'm still in pain, 26 years on, I'm still in pain. But I'm thankful for those extra 26 years I've had.
What type of pain? Emotional pain or physical pain?
No, physical pain.
Wow. Mm,
Yeah, physical pain.
wow. You will be okay by Yahweh's
I
grace.
have neck pain. I have pain in my lower back, sometimes in my knee. Yeah. Because there's no meniscus in my right knee, it was crushed, so it had to be taken out. And so I could only kneel for long periods on one knee, not two. I have difficulty climbing stairs, because of that. But the back pain is the worst. That goes on for a long time. Yep. But, I'm thankful that I go on each day. I can still walk, so I walk at mornings.
Hallelujah.
Yes.
Yes. That's
Praise
the way.
yeah.
Oh, yes. Praise the Lord.
Yes.
Okay. I don't see any more questions. I invite the viewers. Please feel free to contact Dr. Carty. The contact info is on the screen.
Okay, so
The contact information is on the screen. Feel free to contact him. He will be happy to entertain your personal questions. He is always available and he hardly sleep. He loves to read. He loves to he loves to work. He's a
yes,
workaholic.
yes.
He is a night man also. So you will
Well,
always
I'm not a workaholic anymore.
anymore.
I've cut out, but I still keep busy, but not necessarily a workaholic.
Yes. So feel free to contact him,
Yes.
viewers. Feel free to contact him. Take the number on the screen. You could call him on his fixed line. You could call him on his cell phone. He also has WhatsApp, and you can also send him an email. And he has a Facebook page. You could follow it. Please feel free, and we say thank you very much for allowing us in your sitting room at this moment, allowing us on your cell phone, allowing us on your tablet and now allowing us on your very much, Dr. Carty. Thank you so very much. And we
Yes.
pray Yahweh that.
Thank,
Yeah. Yes, we
thank you
pray.
very much. And I do appreciate the opportunity. And I just trust that individuals will make positive decisions based on what they would have learned. As I said, my best wishes to you as you embark on a healthier, more satisfying life. Thank you very much.
You
May
are
Yahweh bless
welcome.
you.
Thank you very much, viewers. So keep in mind that a healthy you makes and keeps a wealthy you. Thank you and have a blessed week. Have a blessed night.